Good afternoon, Dr. Frankenstein. This is Angie, a nurse practitioner with Shadow Health Clinic. I have a patient in the office that needs further evaluation in the emergency department. The patient is a 58-year-old female presenting with a 6-hour acute onset of left-sided chest pain radiating to her left shoulder. The patient denies any injury or previous trauma, reports no strenuous activity at onset. Patient arrived slightly diaphoretic. She denies shortness of breath. She does report nausea but has not had any emesis at this time. The patient has a past medical history of hypertension, hyperlipidemia, GERD, and she is postmenopausal. Upon evaluation of this patient, an EKG was immediately performed, which revealed ST elevations in leads 2, 3, and AVF. We have sent this to the emergency department through Vocera, so you should have this available to look at. Lab work was obtained while we were placing an intravenous line, and those labs included a troponin, a CBC, and a metabolic panel. So far, the only results we have back are the CBC, and those revealed a white count of 9, a red blood cell count of 4.6, hematocrit of 14, a hemoglobin of 14, and hematocrit of 39%. The troponin and BNP, like I said, are still pending. We did do a finger stick, and her blood glucose was 137. We did obtain a STAT portable x-ray, and that is unremarkable at this time. Physical exam revealed a tachycardia. We did auscultate S1 and S2. Lung sounds were clear, and further examination was unremarkable at this time. The patient received 324 milligrams of baby aspirin, of which she did chew. The patient has received 2 applications of sublingual nitroglycerin. Prior to administration of the sublingual nitro, her pain was a 9. After the second dose of nitroglycerin, her pain was down to a 7. It's not time for the third spray of nitro. However, we will be giving that to her in the next 3 minutes as long as the patient remains normotensive. The patient received 4 milligrams of Zofran IV for her nausea, and we have not witnessed any episodes of emesis. We also placed the patient on 2 liters of oxygen by nasal cannula. The patient is currently alert and oriented and stable. The patient's vital signs are blood pressure 158/94, her heart rate 116, sinus tach without ectopy. Her pulse rate is 116, and respirations of 20. O2 sat is 98% on the 2 liters, and it was 97% prior to the application of the 2 liters. Her temperature is 98.7 orally. The patient's weight is 97 kilos. We have contacted the local EMS for transport to your facility, and we were given an ETA of approximately 15 minutes. Is there any further orders you would like for this patient prior to being sent? And we will keep you updated on the patient until transport to your facility. Thank you.